Good afternoon, everyone. My name is Nicole Fernandez. I am the project manager for the Maternal Infant Health Series at Wayside Recovery Center. Today, you will be hearing from Dr. Cirecie West-Olatunji. Our title today for our topic is How Race-Based Stress Correlates to Maternal and Infant mental health for culturally marginalized women and children. I didn't do a very good job of saying that title, so please forgive me. I might want to try that again. How race-based stress is I can't say it, Dr. Correlative to maternal and infant mental health for culturally marginalized women and children. This presentation today will focus on the role of systemic oppression and the mental health and well-being of mothers from culturally marginalized communities. A review of existing research will be offered to highlight the impact of structural biases in various social sectors on maternal and infant mental health and well-being. As a participant, you will learn about specific social action steps that they can take to enhance the emotional and psychological health of women and infants. For any of you who have not attended a maternal infant health series, we are in our second year, and we are really trying to bring back excellent speakers like Dr. West-Olatunji. We are looking to expand conversation. We are listening in community as well as nationally to examine and to bring forth valuable information that will enhance, improve, and reduce disparities and improve outcomes for families. And anyone here who may be attending, we are looking to share resources. Wayside is moving as a next step we've had speakers, we've had experts share information that also have additional programming and community. And we want to make sure that it's not just at a presentation that you learn about these speakers or the resources they provide, but that it could live on our website, and then you can reach out to them via our website to contact them for yourselves for additional information or additional trainings that you might be interested in. And also, for those of you who don't know, Wayside is a recovery center. It was one of the first in the country to serve women and children so that you could come to seek the support that you needed and receive care, stabilization resources, and mental health support and care for the whole family. And so, Wayside Recovery Center is really moving forward with that mission and then expanding that holistic care to families. And so when people think about what we're offering here for the Maternal Infant Health Series, we really are looking at our organizational model and trying to expand and improve every time we come before you. A little bit about Dr. West-Olatunji. She is the Melba Fortuné Martinez Endowed Professor in the Counselor Education Program and currently serves as the Director of the Center for Equity, Justice, and the Human Spirit at Xavier University of Louisiana. Dr. West-Olatunji is the founding director of the Center for Traumatic Stress Research. She is the past president of the American Counseling Association and the Association for Multicultural Counseling and Development. In addition, she has served as editor-in-chief of the Journal of Multicultural Counseling and Development nationally. Dr. West-Olatunji has initiated several clinical research projects that focus on culture-centered community collaborations designed to address issues rooted in systemic oppression, such as transgenerational trauma and traumatic stress. Cirecie West-Olatunji has commissioned, researched under the auspices of the National Science Foundation, Kellogg Foundation, Federal Witness Assistance Program, Spencer Foundation, the American Education Resource Association, Research Association, and African American Success Foundation. Her publications include 2 co-authored books, numerous book chapters, and over 60 articles in peer-reviewed journals. In addition to national presentations, Dr. West-Olatunji has delivered research papers in Eastern and Western Europe, the Pacific Rim, Africa, and the Americas. Additionally, she's provided consultation in a PBS initiative to create a children's television show focusing on diversity through KCET TV in Los Angeles, California. Quote, Puzzle Places. Dr. West-Olatunji has also provided consultation to the Center of American Education in Singapore and the Baruku Liberation Organization in Japan to enhance their early childhood and counseling initiatives. In 2018, Dr. Cirecie West-Olatunji was recognized as an ACA Fellow. And without further ado, I would like to introduce you to our speaker, Dr. Cirecie West-Olatunji. Thank you so much.
Thank you, Nicole. And thank you for bringing me back for your second year. This is really beautiful work. It's inspiring. It really is. It's inspiring to me. It's exactly what needs to be done. So I'm glad to be a part of this. And I'm excited about this topic. Well, I'm always excited about this topic, but I'm excited to share this topic with the attendees today. Let me get started right away. Let's get right into it. This is a topic very near and dear to my heart, really. And it is thinking about race-based stress when we think about adverse childhood experiences. And it doesn't get included. I know when I'm talking to my colleagues in the behavioral health fields, physical health, it's just not included. We don't spend enough time talking about the impact of race-based stress on mothers and on infants. And so that's what I'd like to do today, to bring our attention to this issue and then hopefully engage in dialogue with you. So if you have any questions or comments even, feel free to put them in the chat. And of course, there's a Q&A section, and I'll be answering the questions at the end of the presentation. So I'm going to leave room for questions at the end. But please put them in as you think about them. So I have 3 learning objectives for you today. I am hoping that you'll increase your self-awareness about biases toward culturally and socially marginalized patients, that you will enhance your knowledge about racism and other forms of institutionalized depression and their impact on maternal and infant mental health. Third, I'm hoping that you'll be able to identify specific social justice and advocacy interventions in order to minimize the impact of systemic oppression on mothers in particular. So that's what I'm hoping will happen for you today. The topics that I'll cover will be historical trauma and resilience, because we want to always have a strength-based perspective, traumatic stress and cultural marginalization, specifically race-based stress, its impact on mothers and infants, and then I'll talk about epistemic social justice in healthcare. So let's take a look. It's important when we think about historical trauma that we understand, where did this work begin? And so it was a couple decades ago actually, that scholars began looking at the children and grandchildren of survivors of the Holocaust, the Jewish Holocaust, from World War II, and they were wondering, why did the children and grandchildren have trauma symptoms, even though they had no knowledge of what the survivors had gone through? And so this began the research, and it now has been expanded to take a look at Indigenous people here, Native American communities, to look at people of African descent, Black people, to some degree looking at people in Latino communities, and then also looking at Asian Pacific Islander communities. So we're beginning to take a look at how people are impacted, not only in a generation that was directly impacted, but in several generations later. Also, this fueled information about and research conducted on Vietnam War veterans as well. And then we started looking at things like community violence, and then also life-threatening diseases. So you can imagine the research that's going to come out looking at the impact of coronavirus, COVID-19, and the impact it will have on generations to come. So you can anticipate that that's going to happen. But this is really where it started, and it's looking at the intergenerational impact of widespread trauma. So when we take a look, we know that for mental health professionals, we rely on the DSM that provides us with a way to categorize what people are experiencing. But for the most part, the focus is still on post-traumatic stress disorder. The problem is that traumatic stress and transgenerational trauma doesn't end, so it never gets to post. It is existing in the present and the future. Also, a difference is that transgenerational trauma typically isn't directly experienced by subsequent generations. So it's important to understand that. It's important to understand that systemic oppression is often not included because it doesn't necessarily refer to physical danger, but systemic oppression is sort of the slow drip of oppression that occurs on a daily basis, day in, day out. And sometimes it's quite subtle that even people who experience systemic oppression may not be able to articulate ways in which they are experiencing it. It's really everywhere all the time. Now, what are some of the symptoms? We see depression, anxiety, suicidal ideation and behaviors, substance abuse, and interpersonal violence. So since we've come to understand race-based stress, traumatic stress, we have about 2 decades of research now that are providing us with this information where we're able to connect perceptions of race-based stress and depression, perceptions of race-based stress and anxiety. So we're able to take a look at these research studies to give us an understanding of what's going on. And it's beginning to help us to explain maybe the root causes of what we're seeing as secondary effects. So oftentimes we are treating people with substance abuse issues as though that's the primary concern, rather than it being an outcome of the traumatic stress, an outcome of race-based stress. So it's helping us to better identify what are the root causes. Now, it's important when we're thinking about traumatic stress, and race-based stress is a form of traumatic stress, that we understand how it differs from traditional views of trauma. I often include this discussion anytime I'm talking about traumatic stress, about race-based stress, about transgenerational trauma. I like to continually talk about this because it's generally not covered. And it really needs to be part of our elevator speech when we talk about things like race-based stress. So it's important for us to be able to distinguish these kinds of pervasive concerns as they differ from our traditional understanding of stress. So there are 4 features to traumatic stress. And again, race-based stress is a subset of traumatic stress. So there are these 4 things that we need to always keep in mind. 1, when we're dealing with traumatic stress, we need to understand that it is the environment that is primarily a focus, and that the environment is pathological. So that means when we're working with our patients, with our clients, we may be working with them to come up with interventions, coping mechanisms that they can use to be resilient, but we still need to understand we send them back into a pathological environment. And so they're constantly being impacted, and they need to understand that and have knowledge of the pathology in the environment, of how the structure of our society is pathological when it comes to people and their cultural or social marginalization. The second is that it focuses on the present and future rather than events in the past. So when we think about the present, we're talking about a constant re-victimization on a daily basis. And we're also thinking about the future, arming people against events that will happen in the future. This is very different from dealing with the post-trauma experience, where we assume that it happened in the past and it's not happening in the future or the present. So we're very present and future oriented in the work that we do with our patients and our clients. Third, it observes that the trauma is unpredictable and sudden. So that's really saying that unlike things like, let's say, hurricanes that we experience here in New Orleans, that we get notification it's going to happen. It's just like when we have anniversary reactions that serve as triggers for us around traumas in the past that we can anticipate and we can begin to prepare for it. When we think about race-based stress, it can happen at any time. I often talk about things like starting my day and I'm feeling pretty good. I wake up feeling good. It's a positive day. And then I interact with a store clerk who may treat me differentially. And it can just ruin my whole day, experiencing the microaggressions in interacting with people. So we know that it can be very unpredictable. We never know when we're going to have a negative experience based on how people are positioning us. Fourth, the understanding race-based stress, we acknowledge that the trauma occurs with impunity through institutional means. And what that's saying is that because of the marginalization, oftentimes people who are culturally or socially marginalized are discounted, not heard. And so it's difficult to raise a voice. I know certainly as an African-American female, there is this thing called the angry Black woman, and it's often used when Black women are speaking out and giving voice to their marginalization. And so just the very label silences them. And so it's very difficult. Certainly when we think of something even more egregious, more harmful, when we think about things like people being targeted by the police, for example, where we have evidence, we have research that tells us that there is bias in terms of law enforcement. And so we know that oftentimes the trauma is happening with the support of the very systems that are supposed to be protecting people. So again, if you have difficulty trying to remember anything that I talked about today, I hope that you walk away with this understanding of the very specific characteristics and aspects of traumatic stress theory, that the environment is pathological, it's present and future oriented, the trauma is unpredictable and sudden, and it occurs with institutional impunity. So it's important to understand issues around coping and what this additive effect is, this overlay. So understanding that everybody deals with stressful circumstances, and we may have even a large group of people who are dealing with traumatic stress. For example, COVID-19 is a form of traumatic stress because it's ongoing. It hasn't ended. It's not in the past. As much as I see people trying to think we've gotten beyond COVID, we know that people are still experiencing the effects of COVID, either through long COVID. People are still dying, not only people who are high risk, but there are also other issues. So we're still in the thick of it. People are still having a difficult time connecting with others. We still have isolation issues and so on. But for people who are culturally and socially marginalized, we do get the additive effect. So race-based stress is on top of any of the effects of COVID, for example. And so we have everyday issues and concerns that cause trauma. And for other folks, we get this issue of race-based stress. When we think about who are at risk, we certainly think about people who are not getting the necessary resources that they need. For instance, not getting, healthcare concerns addressed, education, housing, employment, and so on. So we know that people who are living in impoverished conditions are adversely impacted disproportionately. Also, we know that the elderly also are at risk. Many people from culturally diverse backgrounds who experience systemic racism on a daily basis. And definitely when we think about people who prior to or in addition to experiencing the trauma have already been identified as having mental and physical impairments. People who've experienced trauma already from interpersonal violence, from community violence, again, they're going to be disproportionately impacted by racism because the trauma themselves deplete people's coping skills and their ability to bounce back, their ability to be resilient. And so we need to understand the impact of all of these things as an additive effect, really understanding how do people come into this work. When we think about cultural marginalization, I've already mentioned, we've got all these different aspects of people's lives, their work lives, where they live, how they live, what's available to them. And we know that that currently exists. We have research that takes a look at issues around educational marginalization, disproportionality, the school to prison pipeline, and so on, in terms of health disparities and so on. So we really do need to take that into account when we're thinking about adverse childhood experiences and thinking about what are mothers dealing with, what are pregnant women dealing with even before babies are born. How is this stress impacting pregnant women? And how does that impact the birth of their children? And so that is where we are focusing today, of looking at these environmental factors that are influencing the health of mothers and their children. Unfortunately, when we think about how we assess when people come to us, whether we're in physical health care or mental health care, what tools do we have to be able to assess what's going on. Studies have shown that very rarely do healthcare professionals ask about how people are impacted by racism, by institutional racism, by these obstacles that are put up to their daily living. So we don't really get an idea of that except in studies where they're specifically focusing on that, but it hasn't translated into new assessment tools that are readily, handily, and in use widespread by healthcare providers. So we need to think about that. What we do have as resources are often based upon normalcy for middle-class whites, and often even just specifically middle-class white males. So what do we know about the impact of race-based stress? We know that it contributes to high blood pressure, cardiovascular disease, oral health issues. We often don't think about dental issues. And of course, we know that getting dental insurance and support in healthcare is often, even for middle-class families, something that is difficult for us to access or have. For pregnant women, premature labor, low birth weight, for babies that are born to mothers who are experiencing race-based stress. And also we see issues around eating. And I would also add to that sleeping that I didn't put here. So also when we think about psychological distress, I've already mentioned depression, anxiety, substance abuse, and suicidality. So unfortunately, like I said, when we think about pregnant women experiencing race-based stress, even before children are born, it's being passed on to the fetus. And so we know that children can be predisposed for depression, anxiety, substance abuse issues, suicidality, and also eating disorders and so on. That is really happening to them prior to them being born. So it's really important for us to think about these things and take a look. As I said, we've got 20 years now or so of research around traumatic stress, race-based stress. And so we do have studies that you can look at and use to be able to have this dialogue within your agency or your organization to talk about ways in which you need to incorporate a discussion of race-based stress with the populations that you serve. So we have information related to physical health, psychological health, and also education. And don't just think about K-12. There's also research, even I've engaged in research. My research team and I have engaged in research looking at children who are preschoolers, looking at infants and toddlers. Actually, I have a book that's coming out this year, 2023, that's taking a look at working with young children under the age of 5, and how do we intervene with young children, particularly children of color who have dealt with trauma. And it's based on my research as well as others. So I never like to just remain talking about trauma without talking about resilience, because people are resilient. We know that human beings are quite resilient, so that even though they're experiencing racism, institutional racism on a daily basis, people are still fighting back. They are still bouncing back. They are showing resilience. They are coping in so many different ways. And so when we're working with mothers, when we're working with pregnant women, that we need to talk to them about ways in which they're resilient. We need to listen to them as they share ways in which they cope, what coping strategies that they use to be able to respond to their work. I remember developing an intervention with mothers and daughters with their adolescent daughters and asking them, what do they do? So one of the things that I did was ask them to have a conversation. So they had homework to sit down and engage in a conversation with their adolescent daughters about race-based stress and the coping strategies that they use. And that was very illustrative. It was very revealing because although, well, first, one of the things I found out is that mothers were not talking to their daughters about racism that they've experienced or racism that even their mothers had experienced and their knowledge of that. So right away, it was a great intervention to get them to even do it because they didn't think, one, that it was time yet to talk to their adolescent daughters. Also, they were worried that by bringing up the subject that it would cause distress for the girls, that they thought they were introducing it. What they learned is that their daughters were already thinking about, talking about, and already were impacted by race-based stress and really didn't have effective coping mechanisms for it. And it was a relief to them to know that the problem wasn't individual to them. It wasn't unique to them. It actually helped them to know that their mothers had dealt with and experienced race-based stress. It was also helpful to them to hear what their mothers did because they felt empowered because a lot of times the girls were saying in response to experiencing race-based stress, they just cried. That's what they said, that their intervention was. They would go into their rooms and just cry alone. And they also thought there was nothing that they could do about it. And so by having that conversation with their mothers, they realized there were things that they could do to fight back. There were things that they could do to protect themselves in those circumstances. So it's really wonderful to engage in that conversation with them. So it's important to really focus on strengths. What strengths do our patients, our clients have? And do they have stories of resilience? To ask them what are ways in which their mothers and grandmothers have been resilient, have been able to cope in dealing with race-based stress. So it's really important to understand that even though race-based stress may be intergenerational, so is resilience. So race-based resilience is also transgenerational, intergenerational. And so it's important for us to hear those stories, for our patients, our clients to tell those stories about ways in which they've been resilient. Let me give you another example, do a little self-disclosure again. And this is from my own personal life. My mom is 94 and still very vibrant, very active. She still takes walks in the morning and can go about a half a mile or so before she's too tired, and still is out in the yard raking leaves sometimes and dealing with plants. But I'm also getting stories from her. And one day I asked her about how they were able to get out of being sharecroppers, because her father was a sharecropper, my grandfather. And I asked, how did they get out of that cycle? And she told that story. And I recorded it so I can pass it on to my grandchildren so that they can hear stories of resilience in the face of systemic racism. And so it's a very powerful story to hear her talk about ways in which they were able to get out from under the thumb of the sharecropper, of the farm owner. So it's important to talk about that, and it's very powerful. Also give you a story about self-advocacy, and this is really about a study I was conducting where I was going into communities and talking to mothers and about ways in which they've dealt with community violence. And it was just heartwarming to hear these women, some of them didn't know each other, and some of them came from different communities, who said to another, don't carry this personally. Do what your son has always done, create something in his honor, to help people. And at another point in the interview, these are people who are turning to each other, not talking to me, and is saying, you need to know how to fold up your grief and to put it away, to put it in a box, and take it out when you need to. So I really like that idea of not saying don't grieve to get past it, but rather to sort of put it in a box so you can function, but also take it out from time to time and allow it space to grieve, because your love for your son is never going to go away. So we need to ask about ways in which people have been resilient. So when we think about interventions, one of the things that part of my soapbox is community engagement, that practitioners, as practitioners, we need to engage in outreach. We do not need to wait for people to come to us. We need to get out there, and we need to be developing interventions. We need to be engaging in conversations. We need to be developing trust with community people before we need them, before we're asking for something from them. We need to develop the relationship just all the time, anytime. It can be very helpful to us when we're thinking about things. We also need to engage in dialogue with community people as we're thinking about a program evaluation, thinking about research, because they need to inform us. They need to be actively involved in the program evaluation as participants, as collaborators in that process. So we need to engage with the community. We need to get out of our offices and think about ways in which we can provide services, in which we can dialogue, be in community with our stakeholders. We also need to encourage mothers to focus on identity and empathy. These two things have been shown to be important in terms of resilience for people who are experiencing race-based stress. There's about 30, almost 40 years of research around group identity, around ethnic identity, around having a strong group identity, and how it serves as a buffer against systemic oppression, a buffer against race-based stress. So we know that when we're working with people, when we're working with mothers and pregnant women, that we need to talk to them about their group identity, about their ethnic identity, and making sure that they have a strong sense of who they are, and that they're armed against these attacks from the institutionalized oppression. Also, we know that people who are experiencing trauma often can become immune to a lot of the emotional impact. And one of the ways, it's a way of coping for people to have blunt affect because they're experiencing and re-experiencing the trauma over and over again. And so it's important for us to work with them to maintain their sense of empathy for themselves, empathy for others. So we need to think about that. Finally, I would encourage you to connect with programs that are going on that relate to historical trauma, addressing race-based stress. There's a scholar, Dr. Joseph Gahn. He's a Native American scholar, and he's been doing quite a bit of work around transgenerational trauma. So I would encourage you to look up his work. Also, the Association of Black Psychologists have been establishing and creating emotional emancipation initiatives, and you can actually start a project like that in your community, get training, and as a paraprofessional or even as a professional, you can facilitate these emotional emancipation sessions. There's also decolonizing training that goes on where you can learn how to incorporate an understanding of race-based stress into your particular discipline and what the interventions are for that. And then I've created a trauma-informed care model that emphasizes culture and decolonized training. And it's a credentialing program and it's available to you. So those are some things that you can do. There isn't a quick fix. So if you were thinking that I was going to give you like 5 things you can do tomorrow to decolonize your training and to deal with race-based stress, no, it'll take a while for you to go through this process to acquire assessment tools that are developed around race-based stress so that you're able to ask these questions and gather data around this. It's going to take a while for you to get into communities where you're learning about race-based stress and the interventions you can use. I know last year when I did the training, the workshop, I offered the link to a group of videos that I developed. I developed 10 interventions for working with young children 0 to 5 who've experienced trauma. You certainly could use those interventions. They're available free on YouTube. And so you can go to those. And they are grab and go. So you can watch the videos. They're all about 7 to 10 minutes long. And so you could do that. And as I said, my book is coming out this year where you can learn more about race-based stress and how to work with young children. So that's pretty much it. I also have, my social media contact here. So feel free to reach out to me and connect with me there and ask questions and so on. So I thank you so much for that. I am ready to take a look at your questions. Let's
Wonderful.
See.
Thank you, Dr. West-Olatunji. Please put any questions or thoughts or even reflections. Sometimes people stay silent because, well, I don't really have a question or I'm not sure. Please put questions, thoughts, and reflections. Let's have we have a good amount of time to have some dialogue. So let's take full advantage of it. So please feel free to drop those in the chat.
Yeah, and this is relatively new work, so there are no questions that are too simplistic at all or too fundamental to ask. I love some of the comments here. Yeah, I see that. I've been chided for being an angry white woman in reference to this. That's also part of the silencing. So when we talk about socially marginalized folks, women are included in that. And this issue of women speaking up and being silenced by being labeled because it doesn't address the issues that are being presented. Instead, it dismisses them and suggests that there's something wrong with the person who's speaking rather than taking responsibility for what is being said. So yeah, definitely, I totally get that. I see that there's also this new term, emotional vitality. Yeah, that is what we want. Absolutely. It's similar to thinking about compassion fatigue. Instead of compassion fatigue, we want to experience compassion satisfaction because we know that it energizes people. We go to work and we're energized by our interactions rather than being feeling less compassion for people. And so it's important for us to feel this emotional vitality to be able to do that. Racism depletes a lot of our emotional skills. and makes it difficult for us to be able to be resilient and so on. And given the fact that microaggressions occur on such a constant level, it's important that we're aware that we need to step back sometimes. Mindfulness is really good. So if you haven't been using mindfulness, one, for yourself, but also in working with your patients and your clients, I encourage you. I've been doing recent research around enduring self-care to be able to talk about how we use neuroscience and our understanding of neuroscience to rewire the brain so that we can be more resilient in the face of race-based stress. And so it's important to think about mindfulness, whether it's, I say, just stop and smell the roses. Just 1 minute of stopping and being in the present and not thinking about what do you need to do next? What's on your to-do list? What haven't you got done? And so on, who do you need to call back? And, all of that. It's important for us to just stop and be in the moment. And so it's really good to sometimes look up, look at the clouds, watch the clouds go by, take a look at the sky, look at the trees, look at the flowers. Just stopping to do that is really, really important for us. Certainly, if we can do other things like learning how to do deep breathing, how to do a body scan, for example, to know what's happening in our bodies. We retain stress in our bodies. So it's important for us to learn how to check in with ourselves and be able to do that. It's also important to learn how to do other things that are even more complicated, to learn how to meditate. For example, I'm so proud of myself. In 2019, right before the pandemic, I was experiencing back pain. And, with back pain, pretty much they can't do much of anything. And as I was talking with my doctor, I now have a different doctor, but she kept giving me stronger and stronger painkillers. And I said, I don't want to go down this road. This isn't working. So when I went to this back specialist, I got a really different experience. And she was the one who talked to me about some of these complementary and alternative interventions. And she recommended meditation, as well as a couple of other things that I did. But meditation was one of those. And I found a meditation group, and I was going in person until March. And in March of 2020, that group went online. And Spirit came to me, ancestors spoke to me and said, volunteer your Zoom meeting. And that was the best thing I ever did, because I can't say I can't meditate, because we can't have meditation without me getting on Zoom and everybody getting on. And so I've been doing weekly meditation, and we're together for an hour and a half. The meditation, it's generally the sit, it's generally somewhere between 15 and 20 minutes, because we have people who are varying degrees of understanding how to do that, and we want to be sensitive. But it's been really great to be a part of that for the past 3+ years of doing that. So that also is something that you can do for yourself, but you can also do that for the people you serve as well.
Dr. West-Olatunji, I appreciated the fact that you gave us an additional perspective around the intersectionality, right, of where we are with birthing people, as well as mental health or SUD or OUD, and treating or serving, I like to say, people and or members of in our community, we often forget about the intersectionality, how they come, how they present themselves, what is their story, what is their experience. And oftentimes in the birth community, many women of color, similar to many children of color, you experience that, well, you're broken. There's something wrong with you. That's why you're getting these results. But yet what you are saying is repositioning the conversation to understand it's not that people are broken, particularly people of color, but you also need to understand that their experience is different from yours. There may be a greater hardship in certain areas. There may be lack of resources, but we're talking about the social determinants of health, which are impacted by oppression and racism in our country. And so that presents a different conversation and a different purview to look at clients, members of community, and people that we are serving. And I think it requires us to take that step back. So what I'm taking away today, yet again, is really being able to be reflective and not just assume that, oh, well, better care is the answer, or you learning and getting more education about your care will improve your outcomes. But no, let's have time to ask questions and sit and be with people to understand and let them tell us through their own voice, through their own storytelling, what it is that they think they need and or what they have experienced in life before we can even begin to say, here's how we think we can help you to improve outcomes. That's what I'm going to take away today.
Thank you. That is so well stated. Absolutely. I love that. Take a moment and breathe and then think. So it's really important. You know, a lot of times we react to our clients. We don't even realize that we're reacting. We're reacting to how they're presenting themselves, whether they are very articulate in their speech, how they're dressed, you know, all of those things in relation to ways in which we grew up, to our own lived experiences. And we don't realize that we're doing that. So it's real important for us to take a step back and breathe, because that's going to bring oxygen to the brain and allow us to think better, to think well. And then to think, okay, what are they saying, right? So stop and ask them, what's going on? What do you think is happening? What have you done to try to address this? What do you think is contributing to this? To learn more, be curious about their lives. Don't start from this position of, oh, I know what their problem is. I know what they need, but rather being curious about the human condition. When we are at our very best as human beings, we are curious. We lean in rather than away. We want to know, who are you? What is your life about? How is it similar to or different from my life? And how fascinating, how interesting the way in which you're living your life. That is how we are in the best of concerns. That's the best of what human beings can be. They are curious about each other. And of course, they're self-promoting. So human beings perpetuate themselves by supporting each other. So we understand that from a humanistic perspective. So just that idea of stopping, breathing, stepping back, and asking questions is a great way to start. The second is understanding, yes, rather than seeing what you see, what they're presenting to you as the origin, see it as a symptom of the origin, right? So really thinking about that of really what caused this problem and looking at it from that perspective, it's going to help you a lot. And it's also going to be very affirming for the folks that you serve. Absolutely. It's a very narrative perspective where you're both looking at this thing and turning it around from side to side. And it takes the blame out of it. where the two of you are collaborating together to better understand this problem that's occurring. It's a much better way of looking at the circumstances. And then, of course, it's looking at what resources do you have, what interventions, what's in your bag of tricks. So, you know, one of my soapboxes is we need to begin using culture-centered theories in the work that we do. We need to use culture-centered interventions in the work that we do because we want people to recognize what we're doing. So try not to keep giving them things to do that are new to them, but that fit into their cultural framework, and thinking about interventions that match their cultural framework. It's important to do that. And of course, again, that's not overnight. I do trainings, 2-part, 3-part, 5-part, 12-part trainings where I re-educate people and give them new theories they can use, new interventions they can use. So it's a life journey to really decolonize our thinking and make it more culturally appropriate.
Thank you. Thank you so much. I have appreciated the time today. I know I can see in the chat, many people are saying, yes, thank you. They appreciate this information. Dr. West-Olatunji's resources, as I mentioned, we are doing a resource hub. I will make sure that we get links up there, as well as she has shared her contact information. Great work that is happening in community. The last PowerPoint really is being culturally sensitive, cultural humility, not just competent, because we think sometimes, oh, I'm culturally competent, I've done training. No, every day is a retraining, and every person and community that we're serving will teach us and reteach us new things about their community. And we need to be open to that and being willing to pivot, change, understand, be compassionate and empathetic. So I'm super excited about the new tools you've provided us with this afternoon. I thank you so much. We will have other series coming up in 2023 here. There'll be 2 other sessions in February. And then we're going to have a mini conference in May. May 10th and 11th, you'll be receiving some information and email about saving those dates. Thank you all for your participation today, and you will be receiving a survey shortly. I hope that you will complete it and give us the feedback that we need to keep this amazing work going that has been sponsored by the Minnesota Department of Human Services. We thank you so much for being with us this afternoon, and be well, everyone. Thank you.
Bye-bye.